This study is very important. It was published 2 years ago by Italian researchers, and it's the first study where they try to measure the effect of smoking a single conventional cigarette, tobacco cigarette, or the effect of a single vaping sessions of the cigarette, and they compare this effect in smokers and non-smokers. And they measure this effect in terms of oxidative stress and vascular function. They try to find an answer to this question. Does e-cigarette vaping produce a measurable effect in terms of oxidative stress and vascular function? And if so, is this effect comparable with the one produced by smoking a traditional conventional cigarette? So this is a crossover study. In short, 40 healthy subjects, 2 groups, 20 smokers and 20 non-smokers, and they undergo 2 treatments, smoking a single cigarette or vaping an electronic cigarette with the same nominal nicotine content. The main results show that vitamin E levels, flow-mediated dilation are both reduced after e-cigarette vaping and conventional cigarette smoking. So they suggest a negative effect on vascular function in both cases. But markers of oxidative stress such as nitric oxide bioavailability, the amount of soluble NOx2 derived peptide, and 8-isoprostaglandin shows an increase in oxidative stress in both cases, even though with tobacco cigarette this increase is worse. Let's try to understand the concept of oxidative stress. So we can imagine that in our body there is a balance between the reactive oxygen species or ROS production and the activity of the antioxidant system. But when the activity of the cellular antioxidant system is not enough to compensate for the reactive oxygen species production, then we say that there is an increase in oxidative stress. Among the markers of oxidative stress, they measure the amount of soluble NOx2 derived peptide. This is the most common isoform of NOx family, and it is a marker of NADPH oxidase activation. NADPH oxidase is a multi-component protein complex present in platelets, and it induces the production of superoxide anion. NOx2 was shown to be responsible of a decreased vasodilatory capacity. That is one of the main symptoms in peripheral artery disease. And it was shown to be responsible of the rupture of carotid plaques too. However, this administration of antioxidants proved to reduce the activity of NOx2 and so to improve the vasodilatory capacity. Another target marker is the 8-isoprostaglandin or 8-iso-PGF2 alpha. Iso stands for isoprostane, which is a structural isomer of prostaglandin, and it is an end product of the lipid peroxidation. By lipid, we intend the lipid present in the bilayer, the phospholipidic bilayers, and it was suggested as the most accurate method for quantifying oxidative stress in human beings. This sketch shows the main steps of the lipid peroxidation. So on the membrane of the cells, there are some fatty acids, and among these there is the arachidonic acid. Thanks to the help of the enzyme cyclooxidase, it is transformed in various forms of prostaglandins, such as PGD2, PGH2, and the end product PGD2, PGE2, PGF2. During these steps, there is an increase in ROS production, and the end product prostaglandin PGF2 is present in the blood, and in small concentration it can help inducing labor, but in high concentration it is actually used to cause abortion. The vascular function is measured through the measurement of flow-mediated dilation. This parameter is an indicator of vascular endothelial function, and in particular it indicates the capability of the vessels of the artery to vasodilate. It is measured causing a bit of stress to the vessels with, for example, using a pneumatic cuff. The pneumatic cuff is applied either to the arm or the thigh, and it causes a temporary occlusion of the artery. After the release of the cuff, there is an increase in blood flow to allow a rapid reoxygenation of the hypoxic tissue. And if the artery functions well, it dilates, and so this process is facilitated. But if there is an impairment in the vascular function, the dilation is considerably reduced. And flow-mediated dilation is measured in this study in the brachial artery with the ultrasound-based methods. The study design is a crossover study in a randomized order and single blind. The crossover study is a longitudinal study where there is a subject or a group of subjects that undergo several treatments during time. For example, in this case, there are two groups, 20 smokers and 20 non-smokers, and the treatments consist in smoking 1 cigarette or vaping 1 electronic cigarette. In this case, they do 9 puffs in order to have the same intake of nicotine. And sometimes there is a control group. They use a control group in which the subjects smoked a sham e-cigarette, so an electronic cigarette without cartridge, just for a single parameter that they assessed. The randomized order means that these two treatments are proposed in a randomized order. So, for example, some subjects may have first smoked the conventional cigarette and then 1 week later vaped, and other subjects they may have received the treatments in a reverse order. And single blind means that either the subject or the investigator didn't know the order or didn't know which treatment came first. In this case, the study is single blind with respect to the investigator. Of course, they asked the smokers to abstain from smoking for 12 hours before the treatment, and they included in the cohort of subjects people that didn't have infection in the last 3 months in order to reduce confounding effects for what concerns inflammatory responses and oxidative stress. And they excluded, of course, people that took medications or antioxidants. The study consists in getting blood draws before the smoking sessions and half an hour later. And together with the blood draws, they also measured flow-mediated dilation by using a pneumatic cuff at the level of the brachial artery. The two investigated groups of non-smokers and smokers were young adults, well matched by age and body mass index. The body mass index was computed as the ratio between the mass and the square of the height. And there were also healthy people with normal values of systolic and diastolic pressure, and as well as total cholesterol, and no cardiovascular disease risk. Okay, so let's go to the results. This is a very big table where they show basically that both smoking and vaping had an impact on the oxidative stress levels and the vascular function. But let's go and read this table. This is the exploratory inferential analysis they did at the beginning. So they just did a paired t-test between pre and post levels of any of the considered markers that we have introduced in the previous slides. So in the lines represents the levels of these markers before either smoking tobacco cigarettes or vaping the electronic cigarette. And the columns show the results in the overall population studied, as well as in any of the two groups, so the non-smokers and the smokers. And these are the p-values. So the levels of NOx2 derived peptide increased after each of the two treatments in non-smokers and smokers, as well as the levels of the isoprostaglandin. So they increased considerably, and we can notice that in smokers the baseline levels are actually very higher and significantly higher compared to the non-smokers. So the chronic effect of smoking actually has something to do with the increase of these marker of oxidative stress. The nitric oxide bioavailability is directly related to the capacity of the vessels to vasodilate, because vasodilation is mediated by nitric oxide release. And this was higher before smoking. And in both cases, the electronic cigarette had a smaller effect on nitric oxide bioavailability reduction. Also, this antioxidant, the vitamin E, was reduced after smoking or vaping in both the groups. And flow-mediated dilation too, it was reduced, in some cases almost reduced by 50%. They mentioned also that there was a small control group of 4 smokers and 4 non-smokers, and they smoked just the sham cigarette, so without cartridge. And in this group, there was no difference in pre and post flow-mediated dilation. This table here shows the results of the second level analysis, where they used mixed model for the regression analysis. A mixed model is a model where we have both fixed effects and random effects. In this case, for example, if we call y the observable, which is the concentration of one of the markers of oxidative stress or flow-mediated dilation, for example, we will have x and z representing our matrix design. So, for example, x pre in this equation represents the smoking history of the subject, if you were a smoker or non-smoker. XT represents the order of the treatments. So if the subject smoked and then vaped the week later, or vice versa. And XSIG represents which treatment he received. And then in the random effects, we have the interactions between each of these components. Epsilon represents the random errors. So in this table, the mean effects are shown in the first 3 columns, and they're called smoker versus non-smoker, e-cigarette versus e-cigarette, and time. And interactions between them are shown in the last 3 columns. And the column with the e-cigarette and time shows, so these are the p-values, and it shows that the effect of e-cigarette vaping was weaker compared to the tobacco cigarette smoking for what concerns the 3 markers of oxidative stress investigated in this paper. However, the effect was comparable to the one to tobacco smoking for what concerned the levels of vitamin E and the flow-mediated dilation, which is an indicator of vascular function. And they also mentioned that these two parameters were related to each other. So in the end, the e-cigarette vaping had a similar effect to tobacco smoking concerning the vasodilatory capacity of vessels, at least in this study, and just after a single session of vaping. In this study, we only know that the e-cigarette that subjects vaped contained the same amount of nicotine than the tobacco cigarette. So they don't mention which brand or which blend they used for the e-cigarette choice. So the unanswered question here is whether these measurable effects on the vascular function due to the cigarette vaping were due to the nicotine or to flavors additives present in the e-juice or to the base mixture itself. And thank you for watching e-cigarette small talks.